Disease burden is a complicated term in terms of it doesn't just mean what does this illness do to me. If I have a cold, I have a runny nose, I may have a fever, I may feel sick and achy for a couple of days. That is a disease burden. But there are other parts to that. I might miss work, and that has an impact on my financial productivity. I might not be able to interact with other people for a while. That may have an impact on things. The disease burden, I think, for the United States in terms of autism spectrum disorder patients is like $461 billion that it costs. But it's not just for the health care, it's also lost productivity. The patient themselves may not be as productive as they could be in a work environment. But the parents or caregivers for them may also be affected by it. You see parents who are not able to work or have to cut back on their work hours. I am very frequently filling out forms authorizing family medical leave for family members who are trying to care for an adult child on the spectrum and keep them out of a residential setting or keep them out of needing more care. But that comes at a cost for that person, and that's part of disease burden. It's not just the immediate symptoms that affect the patient, it's how it affects everybody else around them. We see families where you see kids, one child has an autism spectrum disorder, that has an impact on the other children in the family. They have to learn how to adapt to that. Sometimes that's problematic for them. They're not getting as much attention as they would have otherwise. And that's a sort of a hidden burden for these kids. There is data looking at if you're an older child and you have a younger sibling with autism, you tend to do better. But if the sibling is older and it's a younger child, they struggle a little bit more because they don't have the cognitive understanding about what is going on with my older brother. So that's difficult. The other disease burden that I have seen in a number of families is as parents get older and they're no longer able to care for an adult child with autism spectrum disorder, who's going to care for them? They struggle with, should we put them in a residential or not? And if there are siblings, will they take care? And that's a huge, I see siblings struggle with this all the time. They feel committed to their sibling and they want to help out, but it's sort of like, but I have my own life to live. I didn't sign up to take care of somebody else, and how does that affect my ability to form relationships with other people, move away, become more independent, get my own job? These are huge deals for not just the patient themselves.
Visit us online at wqed.org/autism for more web extras, links to resources, and to watch the documentary Autism Aging Out.